All right, now, what I'm going to do is show you how to organize your knowledge by showing you a nice organized way to think about viruses without trying to learn about one virus at a time, since there are thousands of them. You don't want to waste your time doing that. There's things that every virus must do. First one, invade the patient. Now, we don't know the day the invasion occurred, but they will ask you, how do most invasions occur? That means, how do most patients come in contact with viruses? The answer is contact, physical contact, the hands. Whether you're sneezing, coughing, or wiping your butt, guess where the viruses are now found? It's on your hands. This is why there's a sink in the room of every patient in the hospital. The physician should wash his hands when he goes into the room so that he doesn't bring the germs in from the last patient. And after examining this patient, the physician should wash his hands as he leaves the room so he doesn't carry these germs to any other patient. However, you see people wearing masks and putting on gowns, but people are not washing their hands. So if you're asked, what's the best way to stop the spread of any virus? The answer is wash their hands. So invasion is step number one. Then adhesion is step number two. Adhesion means the virus will find a way to attach to a cell. The only way you can do that is that that virus has to have receptors for that cell. So that means if hepatitis A can cause hepatitis and gastroenteritis, but not myositis, it means it has receptors for the GI tract and for the liver, but not for the muscle. The only adhesion molecules that we really understand right now is with HIV. Remember, the GP160 molecule is broken down into GP120 for attachment and GP41 for the entry of the RNA into the cell. So adhesion molecules are also understood for influenza A virus, where it is the hemagglutinin molecule. Think about when they say H1N1. The H is for hemagglutinin, right? And if we can make an antibody against hemagglutinin, then the virus cannot adhere to the cell and therefore penetrate it. So those are the only two viruses where it's been well worked out. So the majority of viruses, we don't know what the receptors are, but we know they have them. Third step is penetration. So that means after they adhere to the cell, then they must come on inside. The way to do that is endocytosis. So the membrane wraps around the virus receptor and brings the virus completely inside. The only one who does not do that is HIV. HIV stays on the surface and injects its RNA through the GP41 molecule into the cell. So penetration involves endocytosis. Now if you remember, membrane movement requires three things all the time: calcium, ATP, and microtubules. So that means the cell is already starting to force you, the patient, to use up ATP unnecessarily. So that means you're starting to go into a low energy state. Think about it. Almost every virus is a low energy state. After penetration, then they start uncoating. Uncoating is when the virus removes its envelope, exposing its RNA or DNA. By doing that, he incorporates the RNA and DNA into your genome, the host genome, and forces the host to replicate it. So think about this. We've talked about DNA and RNA before. Remember, the DNA replication, the synthesis of nucleotides, is the most energy requiring process in your body. So that means not only does the virus force you, the patient, to use up ATP for endocytosis, but it forces you to use up a ton of ATP for the replication process, and that's why every virus therefore becomes a low energy state. Think about why pulmonary infections and urinary tract infections are common after a viral infection. You already know the pattern of the low energy state. So penetration, uncoating. After uncoating, then we get the replication process, RNA and DNA. So by putting his RNA into your RNA, you then replicate it. By putting your DNA, their DNA into your DNA, you then replicate it for them. Then after replication, we have assembly. Assembly means to put the viral particles back together. And then we have a stage called lysogeny. Lysogeny is when a virus actually explodes out of the cell. The only lysogenic molecule that we understand is neuraminidase. Neuraminidase is part of influenza A. So the H is the hemagglutinin. That's for adhesion to the cell. And then neuraminidase is for lysogeny out of a cell. So if you want to prevent the infection of a cell by influenza A, you block the hemagglutinin receptor. And if you want to block the spread of the flu, then you must block the neuraminidase. That's why we make the vaccine against the H and the N. Well, typically viruses, when they lysogenize, as they're leaving the cell, they coat themselves with the membrane of that cell. Which means if they coat themselves with the membranes of cells, they start to look a lot like self. Which means when the body recognizes that they are not truly self, the body has to attack them. And in so attacking them, it ends up attacking self, which is how viruses promote and induce autoimmune diseases. This is why if you look in every book, almost every autoimmune disease, they always write it's 2 weeks after an upper respiratory infection. Why do they always say that, yet they can't tell you which virus it is? It's simply because we know this is how viruses operate. So we know they can set off autoimmune diseases. So these are the steps that every virus must follow. From invasion period to the penetration period, the first 3 steps. The person will be viremic but asymptomatic. Because all you have is a few viruses in your system, not enough to make you sick yet. From penetration all the way to lysogeny, we call that the eclipse period, because during that stage, the virus is in your system, but we cannot detect it, just like an eclipse. It's hidden. So that's why we have to come up with different tests that can detect the genetic material of that virus, even though it's inside the cell. And yet there's no viruses out in the blood to detect. That's where the blots will come in, and we'll talk about that in a second. After the lysogenic phase, now the patient is viremic, but very symptomatic, because now you got millions of viruses floating through their bloodstream. So again, the first stage is viremic, but asymptomatic. And that's from invasion to penetration. From penetration to lysogeny, you have the eclipse phase, and from lysogeny on, you have viremic, but you are very symptomatic. We have 2 drugs to prevent uncoating. Notice there are not that many antiviral drugs on the market. Why is that? That's because there's not much money to be made from it. Why would a drug company invest $100 to $200 million to develop a drug that only a few people are going to need? The reason is to remember this. 99% of viruses are going to go throughout your system. Most of them, over 90%, don't even cause an illness. Why? Because they are haptens. The few who do cause illnesses, 99% of people recover without any treatment. So that means a drug company cannot make profit treating 1% of people. So that's why the few antivirals, as you see, are focused on the drugs where a lot of people get ill, and so there's profit to be made. So to prevent uncoating, we have 2 drugs, and this is to prevent uncoating of only influenza A, and that's amantadine or rimantadine. Remember I said the number one thing you got to know about every drug is the mode of action. Amantadine, rimantadine block uncoating of influenza A only. However, action number 2, both of them are strongly anticholinergic. Remember the classic clue for anticholinergic is hot, dry skin, and hyperthermia. Otherwise, everything else is sympathetic. So they both had those 2 actions. Third and fourth action, though, are seen with amantadine. Amantadine promotes the release of dopamine and then blocks MAO from breaking down the dopamine, which is why amantadine is used as one of the drugs to treat Parkinson's disease, as we talked about in neurology. So amantadine, rimantadine are the 2 drugs available on the market to prevent uncoating. So that means if you want to truly prevent flu from spreading throughout a nursing home, let's say, number 1, you would require good hand washing by the patients in the nursing home, as well as all the personnel in the nursing home. Then you would give amantadine to every patient in the nursing home and vaccinate them at the same time. What about drugs that prevent replication? We've got a good list of drugs there. They work by blocking guanine, or interfere with guanine, so that means they're all anti-metabolites. And if they are all anti-metabolites, it means primarily they will interfere with rapidly dividing cells. You should know that pattern by now. And the area that's blocked the most by anti-metabolites, if you remember, bone marrow. So for every one of these, you worry about bone marrow suppression. The first 4 drugs are used to treat herpes 1 or 2. They're equally efficacious. The only difference is how many times a day you're going to be taking it. So acyclovir is taken 3 to 5 times a day. Pencyclovir and demcyclovir are taken up to 3 times a day, and valcyclovir is taken twice a day and now once a day. So that's why it's used more. Now, what do these drugs do for herpes? 3 main things. Number 1, they decrease symptomatic days. Number 2, they decrease viral shedding. And number 3, they will decrease recurrence of herpes. Notice nowhere in there did I say it cures herpes. Beware of the word cure. They'll slip it into the vignette or question, and if the student is not reading carefully, you'll pick the drug anyway, not realizing the drug cannot cure herpes. And if you look at the package insert about the drugs, it'll tell you the patient can still shed virus even while they're on the medication. Famciclovir is used to treat shingles. Shingles is a common viral infection. Most of the time, shingles, remember, is a recurrence of old chicken pox that's been hiding in the dorsal root ganglion. Shingles, the most common reason for an outbreak is just simply the patient is stressed out. So in a young person, because it's just due to day-to-day stress, we don't do any further workup. However, after the age of 40, there are 2 stressors we're always afraid of that we might miss. Currently, it is HIV, so you must do an ELISA test to screen for HIV. And also currently, it is colon cancer, so that means you must do colonoscopy to rule that out. So after age 40, new outbreak of shingles, you must work them up for HIV and colon cancer. Well, where does the shingles usually occur? Top 2 locations. First one is T4. It'll present as chest pain. But now you're left with, how do you separate from chest pain of atherosclerosis? The chest pain of shingles is described as burning. The person will tell you it burns so much they have to take their shirt off their skin. Atherosclerosis has nothing to do with that. All right, it has nothing to do with exertion like atherosclerosis. And the burning precedes the vesicular rash by 24 hours. So the next day, the vesicles will show up. And there's live varicella within those vesicles, so you got to make sure they're not exposed to anybody who's never had chicken pox, because they could catch it from that person. So T4 is the number 1 location, and then the forehead, ophthalmic division, occurring 5, is the second top location for outbreak of shingles. Shingles has 2 bad complications you have to really worry about. Number 1 is chronic pain. A lot of people, especially elderly, who have had shingles, have had years of chronic pain. A lot of them are in pain clinics because of the shingles. So chronic pain is the number 1 complication. Number 2, severe scarring of the skin. Severe scarring of the skin is the number 2 complication of shingles. For that reason, all elder people from age 65 on need to receive a varicella zoster vaccine. They can go to a local drugstore now and get these vaccines. So famciclovir for treatment of shingles. If, for any reason, you give a patient one of these drugs, like famciclovir, and they do not respond to it, it is possible that the virus is negative for an enzyme called thymidine kinase. These drugs have to be activated in order to work. So in famciclovir, if you do not have any response to it, then what we do is switch to a phosphorylated drug, and that would be foscarnet. As you can tell by the beginning, phos, there's a phosphate group already on there, and therefore the drug will then work. Ganciclovir is a drug of choice for CMV retinitis and can actually cure that disease. The rule in internal medicine, any HIV patient with visual problems has CMV retinitis, or to rule otherwise. You start ganciclovir right away. Ribavirin, we've spoken about before, is for RSV. Ribavirin is for RSV, but it comes in aerosol form. So because it blocks rapidly dividing cells, a pregnant nurse should never administer this. So ribavirin. So again, all these drugs that prevent replication. Majority of anti-metabolites that we have and antivirals are to prevent replication. Detectives. These are tests that detect genetic material. And this is primarily during the eclipse phase when you can't really do an antibody test. So Southern blot detects the DNA. So for DNA viruses, we can detect it. Northern blot detects RNA. So for RNA viruses, we can use Northern blot to detect it. Western blot actually detects the protein. That means when the virus is being assembled, we can detect the proteins of the virus. So like Western blot used in HIV to detect P17 and P24 proteins. Southwestern blot is a combination of Southern and Western. So DNA to protein, which is really translation. So Southwestern blot detects translation. ELISA and PCR are put on there just to be complete. So ELISA detects an antibody to anything, and then PCR can detect and actually count the strips of RNA or DNA for any virus. So PCR is used primarily for viral loading, which means you want to count how many viral strips are in the patient, and obviously the higher the number, the worse the prognosis. That's the best way to think about PCR. PCR is also used, as we had discussed in the past, to screen a newborn baby up until 18 months of age, because the ELISA test is not very sensitive in the first 18 months. Mom's IgG, if you remember, interferes with that. So PCR is used to screen.